Nothing warms your heart more than the sight of a happy, healthy baby. But the reality is, even before stepping into the world, these tiny beings face health issues. Perhaps more so than any other episode so far, we need to apply the Shunya mindset to this issue. We owe it to our children to strive for a zero infant mortality rate. Nearly 5% of 25 million babies born in India contract a critical form of jaundice. Alarmed by these statistics, the folks at GE Healthcare combined imagination and innovation. The result? A solution to fight this Indian issue and bring down the mortality rate to zero.
This is baby Anya, born just 15 minutes ago at the Cradle Hospital in Bangalore. Outside her mother's womb, her first home is this bed, GE's Lullaby Baby Warmer, designed to give the much-needed warmth to a newborn.
The need for a warmer is because when a baby is in the womb, it is in a warmth of the mother's womb, which is 98 Fahrenheit or 37 Celsius. So when the baby comes out, every baby, even a normal baby, feels a thermal shock and it feels very cold. It would be like going out in the snow. So what you need is the warmth to be continued for the baby to get acclimatized to the atmosphere. Now, if you have premature babies or low birth weight babies, then they have this problem which is even more severe because they are fighting for survival, and if they don't have warmth, then they use up all their energy to warm themselves, and if they use their energy to warm themselves, then they cannot fight the other things which they need to survive or to grow.
Millions of babies like Anya are at risk. Risk of being born premature and not surviving because of lack of critical and affordable infrastructure.
India has the highest number of infant deaths in the world, and clearly there is a need for equipment, training, personnel and awareness to drive down infant mortality.
Providing a safe start to babies is the philosophy that drives Team GE.
Very simply, the power of Shunya would mean that there should not be a single baby out there who should die needlessly. A baby who dies without access to healthcare and healthcare technology that is available around, right? It is not that the technology is not there. Technology is out there. There should not be a single baby who dies for want of a ventilator or want of a warmer or want of a phototherapy equipment.
Taking their inspiration from a mother's lullaby, GE Healthcare has designed the LED baby warmer and the LED phototherapy system as their ammunition in the warfare against infant deaths.
This is the bed, and what you see here is a mattress. This mattress, for a lot of manufacturers in other baby warmers in India, has a zip or has stitches. This is a non-stitch mattress, and the reason this is non-stitch is that if you have stitches or zip, you will have infection, and then the infection can affect the baby. Another example is the heater itself. The heater is the most crucial part of this product because it provides warmth and heat to the baby. Most heaters in other warmers which are available in India are ceramic or quartz. The problem with those heaters is twofold. One is they don't have the quality or reliability, and they don't last too long, and they can break down easily. Also, they don't have the kind of uniformity that is required on the bed. You don't want to warm the baby just in the center. You want to keep it warm throughout the body. We have what is called a CalRod technology. Again, technology which is used in our most premium product. So we bring the same technology and we put the CalRod heater and we have a nice reflector. And this allows for a great uniformity on the entire bed, which allows for, again, great uniform heating to the baby.
GE Healthcare also has the LED phototherapy system in its war chest, which uses the exact wavelength of blue light for treating jaundice in newborns.
LED phototherapy device is something that is used to cure the neonatal baby of its jaundice. Jaundice is caused because of the high content of bilirubin in the body. phototherapy, because of the wavelength of the LED lights that we use, helps break that bilirubin down to normal levels, and therefore you cure the baby of jaundice.
The cornerstone is addressing the problems of accessibility, affordability, and quality. Team GE has partnered with the government hospitals, private hospitals, and primary rural healthcare centers to make sure technology reaches those who need it the most.
We work very closely with key luminaries. Luminaries are doctors and specialists who are known for, let's say, pediatric care. So we work with neonatal intensivists who know what it means to take care of a premature baby. Second partnership is we work with several governmental agencies because they are the ones that drive policy reforms on healthcare. Working with them, we've got brilliant people there. So partnering with them, helping them understand what kind of technologies we produce. How does it actually drive affordability to the masses?
With its LED Lullaby baby warmers and the LED phototherapy system, GE Healthcare in India is powering ahead in its quest for zero. This is a place where technology gets a human face and a mission for a healthier India is realized.
We want to be providing an environment which is most safe with the least or almost zero risk to the baby, as well as zero failures for the equipment.
Technology is a big cool, but what's cooler for us is the fact that we're actually able to save lives. The fact that we're actually able to solve a problem for a customer where they are able to impart good healthcare to people who could never afford it in the past. That really is what gets us up in the morning and gets us motivated to come to work here at GE.
When it comes to healthcare in India, it seems that the country is divided into two. The first India provides high quality medical care to those who can afford it. And then there is the other India, where there is little access to quality healthcare. This gap needs to be bridged. Throughout the course of the past half hour, we have seen companies on the most important quest of all, a quest to save human lives, working towards zero loss of lives, be it infant health, to preventive diagnosis, to preserving the integrity of medication. If you too have an innovation that is solving or has the potential to solve some of the biggest problems we are facing today, you can write into us at powerofshunya13@timesgroup.com. This could earn you a chance to feature on this show. Until next week, when we take you on another such path-breaking journey, it's goodbye from me, Anupam Kher.
On The Power of Shunya, next week, we meet an innovator dedicated to generating wealth from plastic waste. A company that solves the problem of all your e-waste. And another company that's come up with an innovative way to deal with your kitchen waste.